The role of folic acid in pregnancy. Of all the nutrients, folic acid it plays an important role in pregnancy as well as the pre-pregnancy phase because it is involved in the synthesis of DNA, and it is very essential for the rapidly dividing cells in the fetus, and it is lost through urine. During pregnancy, the daily folate requirement is increased by fetal demands and decrease in gastrointestinal absorption of folate. Older age and obesity in conjunction with pregnancy may also increase folate needs. What happens when folate is deficient in a pregnant lady? The accumulating evidence show that maternal folate status is associated with increased incidence of neurotubal defects. We had already seen what is a neurotubal defect, the spina bifida. So the most common birth defect is a neurotube defect. Presentations vary from anencephaly, encephalocele, to spina bifida oculata and cystica. So these are all related to the absence of brain or the defect in the neural tube formation, etc. Birth prevalence of the neural tube defects is 4.1 case per 1000 total births. So this is how the folic acid deficiency will affect the pregnancy. It will lead to neural tubal defects. This will severely affect the fetus development. So it is wise to consume folic acid in the pre-pregnancy phase as well as in the pregnancy phase. Next is, this is the neural tubal defects. NTD. Neural tubal defects are thought to result from dietary deficiency of folic acid or folate, or a genetic defect affecting the folate metabolism. During pregnancy, the neural tube is formed in the 18 to 26 day of gestation. Various pregnancy complications associated with folic acid deficiency are miscarriage, very important, it will lead to abortion. Placental abruption, this also is very complicated. Preeclampsia. Eclampsia we had already seen, it is high blood pressure followed by coma stage. So this can also, eclampsia actually results in at the later stages of pregnancy. But if the folic acid is deficient from the initial stage itself, it can lead to high blood pressure in the mother. It will lead to small for gestational age infants. It is small size. Then defective 1-carbon metabolism may that is result. Then next one thing that or a vitamin that can be found to be deficient is vitamin B12. In the absence of vitamin B12, it causes megaloblastic anemia. It can be caused by B12 and B9 vitamin. In severe vitamin B12 deficiency, B12 dependent methionine synthase enzyme is inactive. Systolic folate is trapped as L5-methyl THF, secondary folate deficiency. Other forms of folate are used in defective DNA synthesis. High concentration of folic acid can cause a hematological response in patients with megaloblastic anemia caused by vitamin B12 deficiency following associated neurological complications to progressive or defective DNA synthesis. In fact, there is vitamin B12 deficiency. 5-methyl THF could be metabolically inert and could not supply the other folate coenzyme required by thymidylate synthesis. So this is all, you might find it very complicated. Just understand that vitamin B12 deficiency will affect the DNA synthesis. It will cause anemia, that is called megaloblastic anemia. Another important nutrient which is very important during pregnancy and the growth of child. You might have heard about this word quite common in the ad, like DHA. DHA is actually docosahexaenoic acid. Docosahexaenoic acid is DHA. It's very important for the development of the central nervous system in mammals. There is a sudden growth in the human brain during the last 3 months of pregnancy. That is the last trimester of pregnancy and the first postnatal months. That is, postnatal means after birth of the child. So the brain development of the fetus will be at the last trimester, that is the last 3 months, that is the 7th, 8th, 9th month, and also after the birth, that is the first 3 months. Okay, with a large increase in the cerebral content of arachidonic acid and DHA. So at that time, the fetus and the newborn infant need continuous supply of maternal supply of DHA and arachidonic acid. So, for that you need to consume lot of nuts, fruits, and green leafy vegetables. Mainly nuts supply a lot of DHA, pulses, etc. need to be consumed. Now, what are the things that we have to do during a pregnancy? That is, eating right during pregnancy. The 40 weeks of pregnancy is a magical time. Keeping a healthy lifestyle during pregnancy is to be a major concern. Okay, so important steps for healthy pregnancy include eating a balanced diet, gaining the right amount of weight, enjoying light, regular physical activities, taking mineral and vitamin supplements if the physician recommends it, avoiding alcohol, tobacco, and other harmful substances. The don'ts during pregnancy include to avoid unhealthy eating trends. Normally, pregnancy is a state where you have a lot of cravings for sweet snacks and drinks. High fat intake should be avoided, like fried food and processed food. And the imbalance of meals should be stopped. The irregular meal time should be avoided. That is, skipping the main meal should be avoided. Taking in a lot of sugary food and beverages should be avoided. Now, weight gain during pregnancy, we had already discussed that underweight parents or the mothers should gain about 12.5 to 18 kg. Normal weight mothers should gain about 10 to 12 or 11 to 16. Ideal weight is that. Overweight parents or the mother should gain only about 7 kg or 11.5 kg in total. So when we look at what is the weight gain during pregnancy, where it is distributed, like the baby is about 7.5, while the weight gain is due to the enlarged uterus, the placenta, the amniotic fluid, the breast enlargement, extra blood and fluid volume, then extra fat reserves. All these contribute to the weight gain in a pregnant woman. Pregnancy period and the nutrients. The first trimester is the first 3 months. At that time, a rapid cell division occurs, organ development occurs, the preparation for the demands of rapid fetal growth occurs during the second and third trimester. Okay. Now, critical nutrients during the first trimester is protein, folic acid, vitamin B12, zinc. In the later months, energy intake is important since 90% of fetal growth occurs in the last half of the gestation. Critical nutrients during this period is protein, iron, calcium, magnesium, B vitamins, omega-3 fatty acid, docosahexaenoic hexanoic acid or DHA. The energy requirement during pregnancy. Additional energy needs for normal weight women are about, during the second trimester it's about 360 kilocalories. Third trimester is about 470 kilocalories. While lactating, it is 500 kilocalories. Different energy requirement for differences in age, body size, pre-pregnancy weight and lifestyles. It will vary. Now, an addition of 300 calorie is not so great. That is, you don't need to consume a lot of food there. If you consume a piece of steamed fish and one fruit slice of 60 kilocalorie, you will have about 300 calories which we require in addition. If it is an egg sandwich, about 185 kilocalories is got from it, and also a glass of milk supplies 125 kilocalories. So that will supply your healthy choice of 300 calories. Then regarding meal planning, we should have a regular meal plan. Meal planning. Regular meal time to get balanced and complete nutrition is essential while during pregnancy. The carbohydrates. The function of carbohydrate is to supply energy to promote weight gain of the fetus, placenta and other maternal tissues. It includes rice noodles, whole grain breads, cereals, milk, fruits, starchy vegetables, etc. But there is a precaution that you should limit the refined sugar intake like sweet beverages and fruits. The limiting of sugar intake should be, done because it can increase the risk for gestational diabetic conditions, gestational diabetes. Okay, so that is the thing that we have to pay attention while taking in a lot of carbohydrates. Second is the protein. You get about 7 grams of protein in 1 glass of milk, or 4 rounded tablespoons of powdered milk, or 2 thin slices of cheese, or a 3/4 cup of yogurt. So the total protein consumption during a day will be that a pregnant lady requires is about 60 to 65 grams, so that it can be adjusted by planning meals accordingly. Like at a breakfast you can have a egg white and a glass of milk, then next by 10 o'clock another glass of milk, by lunch a piece of meat, and afternoon snack with a cup of milk, and dinner with a piece of consuming 1 fish, and at supper ending that is at night time you can take a glass of milk. This will give the pregnant women enough proteins to meet the daily requirement of proteins. Now nutrient intakes, that is the healthy choices are what we need to encourage is that we have to take we should allow the pregnant women to take fish twice in a week, take more beans and soya products, and we should give priority to fresh food, use natural spices, herbs, and lessen the use of seasonings in the cooking. That is, less use of oil, and you should use more of the natural ingredients rather than depending on the processed and canned food. We should always reduce red meat intake like the beef and pork. We should reduce the processed food intake like you have canned foods, packeted foods like noodles and all that. And also we should prevent or reduce or minimize the consumption of preserved food like salted fish, salted eggs, pickled vegetables, or use of junk food like chips, etc. Then fats need not be avoided totally, but fats are required at 54 to 82 grams per day in the second trimester and third trimester, a bit more like 57 to 85 grams per day. So fat deposits in fetus will increase from 2% at mid-pregnancy to almost 12% at the term. So more completely if you are consuming more of the fats, it will lead to increase in the serum lipid during pregnancy and also in the cholesterol level of the mother. So that is something which we have to pay caution to. Now, fats in the diet, the healthy choice of taking in healthy fat choices are using vegetable oil and fish, reducing fried food intake, fatty foods high in saturated fats and cholesterols like the skin of the chicken, egg yolks, seafood, etc. And also to reduce the consumption of trans fat food sources like cakes, bakery items like biscuits, fast food, etc. But omega-3 polyunsaturated fatty acids are very essential for the fetal brain and eye development. We should encourage to take